Can progesterone help with pregnancy? Yes, yes, and yes. Progesterone stands for Pro-Gestation. Gestation means the process of being carried in the womb. It's used extensively in infertility clinics, especially great for women who have had a history of miscarriage. It has been studied for 60 years in pregnancy, back to the 1940s, so it is safe. Now here's how it works. Progesterone aids in conception because it prepares the uterine wall for implantation of the fertilized egg. The wall needs to be strong because an egg could fertilize but not implant, or implant but fail to survive. Progesterone stimulates the maturation and growth of your uterus to make that wall strong and ready to receive your fertilized egg. Good progesterone levels during pregnancy are crucial for survival of the embryo. Progesterone keeps the uterus from contracting and expelling the embryo in early stages. So you end up with a good, viable pregnancy. It promotes the growth of the blood vessels that nourish the baby and significantly reduces the rate of preeclampsia, also known as toxemia, which threatens the baby. Some infertility doctors will give you a vaginal progesterone suppository if you've had this history of miscarriages or infertility. But you don't have a doctor and you're wondering what you can do, you can use progesterone on your own because it's very safe for both the mother and the baby. When in the third stage of pregnancy, progesterone levels in the placenta are 6 times higher than the levels in the mother because the placenta is making progesterone. It's God's link between you and your developing baby. So it's good for you and good for the baby. Now, this is a little bit aside, but this is very interesting. I have seen recent studies that show the children of women who use progesterone during pregnancy, the children tend to be more advanced. They walked earlier and had above average achievement in academics, school. If the mother used the progesterone early in her pregnancy, the children seem to benefit the most. Wow, God sure knows what He's doing. When He gave us the Pro-Gestation hormone, He had our best interests at heart. It's also good for postpartum depression if you've had a baby and you suffer with that. How do you use it? Well, you're menstruating if you're in pregnancy age, so you're going to use 40 to 80 milligrams a day for the first trimester with no breaks. After 3 months, the placenta is making very high amounts, so after the 3rd month, you can just gradually decrease it. If you've had a history of frequent miscarriages, you may choose to continue all the way through to the week before you give birth to give yourself some peace of mind. Now, be sure it's bioidentical, no synthetics for our babies. We have many testimonials and baby pictures from happy moms. I've been doing this for over 30 years and I'm telling you, ladies, it works. Let me know how you do. I care. And don't you be discouraged. I had my son when I was 40 years of age, and my friend had her son when she was 45. So start thanking God for your baby. Do you want to read more about the studies? I've got them all here for you so you can have them in your hand. I'll get them to you as soon as possible. And my favorite progesterone cream is good old ProHELP, right here in the red jar. Thank you for watching.